The client lies on their back. The first thing I do is ask the person to move down the table a little. The head should lie directly on the surface of the table. We place a cushion under the knees for lower back comfort. We move the cushion, check the client's comfort, and begin further work. I can remove the headrest at this stage, as it will interfere with the massage techniques. In this position, my goal is to work the upper pectoral muscles and the back of the neck. Apply oil to the pectoral muscles and décolleté area. Rub the oil with your palms, preparing the skin. We apply our hands and perform a smooth distribution of oil over the entire upper chest. We work in the décolleté area. In women, the same décolleté area is worked out. We do not go to the mammary gland itself. For what in back massage, we be sure to pay attention to working out the chest. If the client complains of pain in the upper or lower back, this is often associated with slouching. When slouching, the shoulders go forward in a characteristic body position. In this state, the pectoral muscles, the pectoralis major and minor, are in a shortened state. The pectoralis minor muscle is attached to the shoulder and goes to the ribs. It often pulls the shoulder girdle forward. To achieve a lasting therapeutic effect, we must work it out. Therefore, in both men and women, we supplement back massage with work on the chest and décolleté area. Apply oil and perform circular rotations, placing the main emphasis of pressure on the pads of the fingers. Movements should be soft and smooth. Here we can clearly feel the relief of the muscles. We are working on the pectoralis minor muscle. I do not allow slipping on the skin. I fix the tissues and perform deep circular displacements of the muscles relative to the bone base. After working with 4 fingers, I perform additional work with my thumbs. We start from the center line of the chest and gradually move to one of the sides. All movements are performed sequentially, directing the force towards the shoulder. We go to the shoulder itself, carefully working out all the places of attachment of muscle fibers. Then we return to the center and proceed to work out the other side of the chest. What is important to pay attention to is the part where the chest ends at the base of the neck. Here we enter extremely carefully. It is impossible to apply deep pressure along the central line of the neck. We only work on the chest where the skeletal part is clearly felt under the hands. Also remember about the clavicle, it is strictly forbidden to go behind it to the anterior surface of the neck and press there. We smooth out the worked area. You can also perform cross pressure with your palms. We place our hands and perform a palm extension towards the shoulders. The movement has a V-shaped trajectory, opening the chest area. This allows you to very effectively open the chest and stretch the shortened muscles. We can also fix the pressing of the pectoral muscles by pressing with the weight of our own body. The pressure is applied to the entire area of the shoulder joint from top to bottom. In this way, I stretch the chest and contribute to its maximum opening. At the same time, passive pressure is created on the hunched back, helping it to straighten up. Under such directed weight, slouching is literally corrected. After that, we gently move on to stroking. We perform kneading of those areas that we have just affected by the weight of the body. Performing gentle smoothing, another option for working with pronounced muscle shortening. If the pectoralis minor is severely spasmodic, we take the client's arm and move it to the side. With this abduction, the pectoral muscle immediately stretches and becomes easily accessible for massage. We use the outer edge of the palm node and perform circular rotations and squeezes. Carefully knead the area, then place your hand on the client's shoulder. Visually find the attachment point of the pectoral muscle to the shoulder, press it, and lead it to the center of the chest. Perform a deep squeeze towards the center of the chest, and then in the opposite direction. The movement should be smooth, soft, and confident. Repeat the technique 2 to 3 times. Remember that the pressure is applied strictly to the muscle tissue. We do not press on the neck and collarbone, and we do not go on them during the deep squeezing process. I do not put pressure on the collarbone itself, working exclusively on the soft tissues under it. Squeeze the muscles here. You can also go well on the front of the shoulder. We reach the attachment area of the deltoid muscle and biceps. We change the position of our hands, make an interception, and proceed to a detailed study of the large pectoral muscle. We start from the line where the biceps and deltoid muscle originate. In the recess between these muscles, the pectoral is attached. We start squeezing with the thumb. We methodically press the fibers moving along the course of the pectoral muscle. Now I was doing a direct squeeze, but you can also do semicircular squeezing movements. The finger squeezing technique with simultaneous stretching of the client's arm is very effective. I fix the finger on the pectoral muscle, squeeze it, and at this moment move the client's arm to the side. The muscle is stretched under my finger, which remains stationary at the point of maximum pressure. Press the point and slowly move the hand away, creating a deep stretch. After that, we perform stroking. You can duplicate squeezing with your palm in the same way. Press the palm against the entire surface of the muscle and move the hand to the side for stretching. We smooth out the area. At the end of the treatment of the chest area, we perform vibration. We make a light, relaxing vibration of the entire area that we have just massaged intensively. Gently return the client's hand to its original position, performing the final general stroking of the entire chest. If there is also a pronounced spasm on the other side of the chest, repeat all actions symmetrically. After thoroughly working with the pectoral muscles, we smoothly finish this stage and lower our hands. Let's move on to working the upper part of the shoulder girdle. I go down a little lower to the head of the bed and go directly to the shoulders. I perform the following technique. First, I do a light pressing of the tissues, after which I smoothly spread my arms to the sides. This movement provides a high-quality general relaxation of the entire upper surface of the shoulders. Then, with a sliding motion, I change the position of my hands. I put my palms under the client's shoulders and trapezius muscle, starting the massage of the cervical region and the upper part of the trapezius muscle. I grasp the neck muscles with 4 fingers and, using the natural weight of the client's head, begin to perform rotations. Under the weight of his own body, the client's head makes rotational movements while my fingers deeply work the tissues. In this position, the neck muscles are maximally relaxed and are in a comfortable position. This allows you to work them out most effectively and deeply without causing tissue resistance. I perform 3 to 4 repetitions, starting the movement from the top of the trapezius muscle. Gradually, I go higher and reach the hairline at the base of the skull. We perform pulling strokes in the direction from the trapezius muscle to the back of the head. If a pronounced muscle spasm remains in the area of the 7th cervical vertebra, we pay special attention to this area. This area, where a characteristic compaction often forms, needs to be worked out additionally. Working here with just your fingers is not always convenient, as physical strength is often lacking. Therefore, I change the position of my fingers, placing them under the area of the 7th cervical vertebra, and perform deep rotations. You can work alternately with each hand or perform movements simultaneously on both sides. A technical nuance of how to perform a strong squeezing motion without overloading your hands. Lifting the client's head only with the strength of your biceps is extremely uncomfortable and tiring. It consists of using a lever. I rest the base of my wrists on the surface of the massage table. To lift tissues weighing a human body, I use the table as a fulcrum and create a lever. When my elbows go down, my hands automatically rise up along with the muscles being worked. Look, I effortlessly lift the desired area without using any biceps at all. My hands are not tense. I only get a little hooked by shifting the center of gravity of my body down. This gives me the freedom to perform deep rotations, the impulse for which comes from my entire body. All manipulations are performed by the coordinated work of the entire body of the massage therapist. After a quality workout, I press my fingers into the top of the trapezius muscle and guide them along the neck. I work through the neck muscles all the way to the occipital part of the skull. I return to the starting point and duplicate this deep movement once again. My fingers are close together and move strictly along the cervical spine. I walk exclusively along the muscle strands, reaching the base of the skull. At the points where the muscles attach, I rest my fingers against the edge of the occipital bone. My hands are now securely holding the client's head in a raised position. In this way, we simultaneously perform a deep pressing of the attachment points and stretching of the neck extensors. We hold this position for 20 to 30 seconds to 1 minute. As the muscles relax, the client's head will begin to gently lower back onto the table on its own. When I feel that the muscles have yielded, I maintain pressure with my fingers on the tissue. And I perform a short movement in the opposite direction, from the base of the skull down to the trapezius. This creates additional accented stretching of muscle fibers. Again, we take a short pause, then move on to warm up circular rotations. We warm up the tissues, stimulating an active flow of fresh blood to the area we have just worked on. This is necessary to consolidate the therapeutic effect and flush out metabolic products. Now I want to perform a more intense stretch. I fix the neck muscles with 4 fingers and gently pull the client's head towards me. With 4 fingers, I firmly grasp the base of the skull and create a gentle axial extension. This decompression movement allows you to gently increase the distance between the cervical vertebrae. We hold this delicate stretch for 10 to 15 seconds. After that, gently release and move on to a soft, relaxing kneading. To achieve the most profound neck extension effect, we can use a special technique. Often, the strength of the hands alone is not enough for a complete and stable stretching of the cervical spine. In such cases, using a towel is ideal, but don't start with it right away. First, you need to work with your hands to feel the client's neck and understand the specifics of its tension. Only after that do we proceed to the final stretch using a towel. I carefully slide a rolled towel under the client's head, lifting it slightly if necessary. We place it evenly and symmetrically. The towel should cover the neck and reach the upper edge of the trapezius muscle. It should not go deep under the back. We fix their neck in the occipital part of the head. I grab the ends of the towel approximately at the width of the client's neck. I smoothly pull the towel towards myself, ensuring reliable fixation of the head. I pull simultaneously upwards and towards myself. It is important that the towel does not slip on the skin. If the fixation slips, the stretch will be incorrect and will not give the desired effect. I lift the client's head just at the level of the line where the muscles attach to the skull. This is a critical line. We pull not from the middle of the neck, but from the base of the skull. Having fixed the towel at this point, I begin to perform a smooth and strong tension on myself. Having created the necessary effort, we linger in this position for 10 to 15 seconds. After that, release the tension as smoothly and gently as possible. I emphasize once again that the fixation line should run strictly along the border of the skull, exactly where the occipital bone begins. We lift the towel and press the muscles with it. After a tight fit, I turn my hand slightly to increase the thrust vector, and I perform the final decompression traction of the cervical spine towards myself. Without using a towel, it is impossible to achieve such a tension force. Such decompression cannot be achieved with just fingers. I gently release the tension after I remove the towel. I perform gentle circular kneading of the neck. I go over the places where I pressed the towel again, performing 2 or 3 repetitions. For clarity, I will show the technique again. Here is where the skull begins, the attachment points of the muscles. I grab the towel on both sides. If you take it too wide, you won't be able to pull it comfortably over yourself. I choose the optimal hand position, approximately the width of the client's neck. With my index fingers, I fix the fabric, and with my thumbs, I tightly clamp the edges of the towel. I lift my head by using my fists as leverage against the table, changing their position. I move my hands from the lower position to the upper position. This allows me to lift my head and securely fix the towel. Only after fixing it do I start moving towards myself. Important, I never pull with the force of my hands. My hands remain still, and the tension is created by tilting my entire body back. This makes the neck extension smooth and completely safe for the client. I am in full control of the intensity of the impact. I can hold this position for some time. Gently released and performed an additional relaxing neck massage with my fingers. After a quality neck extension, I begin to work on the anterolateral surface. We work along the line of the sternocleidomastoid muscle SCM. These muscles are attached under the ears. I run along them with soft circular motions. I perform 2 to 3 passes back and forth along the entire length of the muscle. I finish the work with a light, soothing stroke. This back massage is now complete. The main thing in this technique is to observe the full complex and sequence of techniques. We start with the lumbar region and the upper part of the gluteal muscles, preparing the base. Then we smoothly move to the upper back, carefully working out each zone, including the arms and neck. After that, the person lies on their back, and we work on the upper chest and décolleté area. In conclusion, we do a neck extension with massage. Only such a comprehensive approach gives the maximum result. The person clearly feels the effect after the first session due to the deep study of each muscle. Using deep techniques allows you to eliminate even long-standing clamps. In the future, I will show you additional exercises from the PIR technique of post-isometric relaxation.